we have a couple of platforms and a couple of things that we will do today. One is the Homepital main app, which you can see here. This is the patient-facing app. And then we will also go through our platforms let me know once you can see my screen. Can you see my entire screen or not?
Yes, you can. We can see. So the first platform is like the app which is used by patients, right?
Yeah, and then we will move to this web thing. This web
Mm-hmm.
URL is the physician one, and then we will move on to admin portal, and then we'll move on to real-time patient monitoring. So,
Okay.
so we'll go
Just
in.
one.
So starting from this, let's navigate the app first from a patient perspective only. So this is how the patient face looks like, fully customizable. So you can search doctors here. Okay. You have other things like check your symptom. This is an AI-based symptom checker
Uh,
with over 90% accuracy,
90%.
over 90%.
Uh,
And then you have features like book appointments, in-app messages, patient awareness content, and health data,
Health data is the patient's health data, right?
patient health data, yes.
Okay.
Right. So let's go one by one in each thing. So you can see this thing here on top right corner, everyone.
Mm-hmm.
So one of the very outstanding features our app is that we allow adding family users. So you can basically add family users. So if you have dependents, you can actually add your dependents in your app. So they don't have to download their apps because under 18, apps shouldn't be downloaded by children anyways. So that's the very first thing that we tell patients to do. Okay. So now if you are a patient and you want to search doctors, you can search the doctors through the tab, and then you can search by country. If you have countries, for Uzbek, we can just fix this field to Uzbekistan, or we can actually default the whole thing to Uzbek and put cities here. So Tashkent and all your locations can be here, so people can actually pick cities, and then they can also pick specialties, which specialty they want to look at. So they can just pick specialties. We have about 92 specialties built in, so they can just click the specialty or search specialty, and they can pick the doctor, and then they can look into the doctor's profile, specialties, brief bio, whatever we want to do. So this enables patient to select doctors at their choice.
But do you want to say that we can choose the doctors who are located in a different region as well?
Yes, you can.
And then get the consultation from them online.
Yes, you can. So the next thing is the symptom checker, the AI-based symptom checker. Now, this is a hallmark feature as well, because what has happened is when we have used it here in the UK, as well as some usage in UAE, a lot of patients who go through the symptom checker, they can be stopped going into primary healthcare system unnecessarily. So, for example, in the UK, about 30 to 35% people who um, we can avoid them going to primary healthcare just by checking their symptoms and doing the necessary things. So that saves a lot of cost for our primary healthcare system because, like, for example, a parent with a viral temperature, viral fever, there is no point in going to a doctor because they are not going to give you antibiotic for 38.4 temperature. I'm a doctor myself. My daughter, like, she has vomited last night, 3 vomits, 3 diarrheas. So the first thing she asked me, "Do you want to give me antibiotic?" I said, "No way on earth. I'm not going to give you antibiotic for the first one day." So that saves a lot of what you say, time and energy, as well as money uh, for your healthcare system. Right. Okay. So what we'll do is we'll try to go through one just quick run through how this looks like. So for example, you click check your symptoms. In English, we have naturalized language. So what happens is like it doesn't matter what you write or spelling is. It just corrects it. It just corrects it automatically. So we'll just go through a bit of a journey. Don't guess my age. It is like literally not my age. But just
Okay,
writing
yes.
a fever. You can't see my clicks, but I'll just put my cursor so you know what I have clicked. 38.8. Uh, Headaches. Let's say no. Do you have pain in any part of abdomen? No. We are ruling out gastritis. Do you have cough? Let's say yes. Okay. Wheezing sounds? No. Not asthma. Do you have shortness of breath? Yes. Please indicate whether you have any cardiovascular risk. No, 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 no. Have you smoked in the past? No. Trouble speaking due to shortness of breath? No. Can you count the yes? 20. Let's keep it simple. Uh, Days. Let's say 3 days since the symptoms started. Uh, Symptoms are not improving. More mucus than usual. No, let's keep it dry. So it has actually given almost exactly what I was thinking. The case was coronavirus or community acquired pneumonia. So when you go down, gives you different things. Now, one of the key features is like, if we want, uh, and if this thing says you need to immediately schedule an appointment with a healthcare provider, it allows you to click to proceed. When you proceed, this whole thing, what we have done, will automatically go to the physician, automatically gives the same thing you filled in the very first instance automatically. So you don't have to write anything. Another thing that it allows you is messages. So what happens is like a GP can send you a message or physician can send you a message, and this message can be seen by the patient in app, and they can reply if the physician has allowed a reply onto it, you know.
Only
So
if the physician allows to reply.
yeah, right. So next up, we'll jump to another set of features is choice, blogs, insurance membership, devices, care plans, and an innovative feature called Check Health. So for example, what we do is we allow patients to see awareness content like COVID-19, diabetes. So we can add as many things here, and then they can click these things and then as their choices, and whatever they have clicked, they can see those choices in their thing. Now, another thing that we can do is we can put insurance there, and we can have some sort of subscription or corporate membership. If that model is in Uzbekistan, we don't know what the model is. Like UAE's model is different from UK, yours is different. So this again comes to business practices. So if we want, we can have these models implemented as well.
What do
And
you mean
then
by corporate membership? I'm sorry.
it's like subscription models. So for example,
To
if
the
you want,
hospital?
yes, yes, yes.
Ah,
So
okay, I
if
see.
someone has a specific subscription to a specific service, they can have it there. So those sort of
Okay.
things. Yeah. So it's just to give flexibility to the healthcare providers or payers to maximize things. Now, another
Okay.
key feature is this health devices thing. So you can see this thing that these are IoT devices that we have pre done. So you can see two devices at the minute connected. So if I click pulse oximeter, what will happen is it's going to show me real-time data from my pulse. Like literally, it's on my hand at the minute. I wish I could send that picture, but it is on my hand.
This is a real-time monitoring, our remote patient monitoring, real-time. We can connect any devices using not using IOMT, which is Internet of Medical Things.
And then for people with chronic disease management, we have the thing called care plans. So we can monitor their things. So for example, a diabetic patient or with hypertension, you can monitor their things as well, whatever they have. They can also do tasks here, and they can set reminders for
Mm-hmm.
themselves.
Mm-hmm.
And then we have these upper and lower thresholds defined.
Mm-hmm.
Each patient's upper and lower thresholds can be defined by their doctor or physician because each person has different. So, for example, my blood pressure, normal blood pressure is 145/90. Whereas in medical terms, that is called grade 1 hypertension, but that's not grade 1 for me because that's my normal thing.
Mhm.
So anything that is above 145 would be considered as blood pressure for myself. Now, another beautiful thing about this whole thing is that for chronic patients, I don't know if you have any one of you have your parents or someone with chronic diseases. When you go to a doctor and they ask you any different symptoms, it is difficult to remember these things as to when it came, what happened. So what we do is we have this e-diary here. So they can go in and they can add symptoms here uh, through date, whether it's morning, it's evening, which date it occurred. So when they want to go to a doctor or they are doing this consultation, they can always tell the symptoms quite easily and quite objectively rather than just vaguely like, oh, I had digestive problem. It might be 3 days ago. I don't remember it. And that's a very crucial point for us when we are diagnosing a patient or when we are looking at different things. So then there's another innovative feature called Check Health. What it does is that this gives you quite a few things using your facial landmarks. I can't show it at the minute because if I show it, this is going to disconnect because two video calls won't work in one go. But then it just gives you heart rate, respiratory HRV, heart rate variation, respiratory rate, and then there are more innovative features coming in as well. So what we do is we keep on adding features. So for now, this is one of the things.
Check health. You mean you can check your health features using this app, right?
Yes, you can, yeah. And
Uh,
this keeps recording it here in
uh-huh,
the
uh-huh.
patient profile.
So, for example, if you use the tonometer, like the to check your heart rate, for example, and it will be automatically connected to the program, to the app, right?
To the app, yeah. So
Yeah.
there are three different things. One is
Uh-huh.
the IOMT, which is here.
Mm-hmm.
This is a built-in feature, Check Health. And then
So
yeah,
it's for example, whatever device doctor uses, it will be recorded in the system.
no, so those devices have to be
Integrated to the system.
integrated with the system, yeah, and they have to come
Okay.
from us. The another thing that we have is uh, the Health Kit and Google Fit. Those are also integrated. So, for example, if you have a smartwatch, it's
Mm-hmm.
already integrated automatically. So those things will go into the system automatically. Anything that is Bluetooth integrated, that goes into the system. If it is connected to HealthKit or Google Fit as well. So
Yeah.
we have like 2 or 3 way system, IOMT, Bluetooth, and integrated things like Check Health. So
So,
you have
answering your question, Munawar, that we can integrate anything, any device, even if you, let's say, in Uzbekistan, you have invented a device for heart rate. You
Mm-hmm.
give us the API SDK, and then we can integrate it to the system. So this is no issue. Any device, once you have the SDK, we can integrate it.
Okay.
yeah, and this is what
Oh.
makes it quite different from all the other apps on the market that we can integrate any medical device as long as you provide SDK, we can do that, and then the patient, the physician, nurse, or carer can see the data in real time.
Allergiye to'g'risida ma'lumotlarni o'sha yerda turar ekan.
Allergiye to'g'risida?
Shunaqa deb yozib qo'ydi, allergiya deb mana.
Allergies. Farhad is asking about allergies. You see, we can keep the information about our allergies as well, right?
Yeah, so this tab is all about medical records.
Mm-hmm.
So for example, patient medical history, diabetes or whatever, they can have it here. And then all his prescribed medication would show up whenever anything is prescribed to this patient. Allergies, they can add their allergies here, whatever the
Mm-hmm.
allergies may be.
Mm-hmm.
Medical reports, all the medical reports, if they have, they can upload it here. So for example, this is a chest X-ray, PF confirmed, or MRI scans or CT scans, anything that we want. So the patient can add reports, and we have like lots of options. They can add like from any of these options. Also, if a nurse uploads a report, then that will be seen here as well. And another very beautiful feature is pharmacies. So they can add pharmacies according to their location. So for example, this is where I'm living. I can pick any location of my choice, and this is going to be there. So if you take our e-prescription thing as well, which is there, so we can send a prescription straight to their nearest pharmacy that they want, and then they can just go and pick it up from there. They don't have to print things. They don't have to go to the hospital or clinic to pick that pharmacy to get the prescription. They just go straight to the place, take their medication, and come back. Can you guys still hear me?
Yes, yes.
Right. So what I've done is now, in the interest of time, I've just made a call to myself. I hope you guys can see me on all of it.
Yes.
So this is the patient app, and this is the physician app on your right.
Bu
You can
hozir
see
doktor anaqasi o'sha telekonsultatsiya bo'ladigan paytda mana bu chap tomondagi doktor, o'ng tomondagi patsientni nimasi, oynasi.
now another thing you will see is this location here. So this we take for the emergency use, just in case something happens to a patient. Then at least from this thing we can catch the patient quickly and do the needful. So because it's echoing, and I just wanted to show the call, I'll drop off and then I'll just reshare my screen. So from a physician perspective, this is a physician portal. You can see all the future and past appointments. From here, this was the patient I called. So you can directly call as well, other than the appointments. And this is the patient history. So you can go in and see the patient history before the appointment starts. You can see
This is
what
only one patient, right?
for now, yeah, because this is
Yeah,
the one
for
that we are
one.
showing up, yeah. And then you can see all the everything that has to do with this patient. So this is the, I was showing you the CT scan of lungs and the MRI. All of it is here, so they can see whatever they want to quite easily. So this I purposely showed you a DICOM report as well. So in case you have multiple slices of any scan, in DICOM, our system can take DICOMs and show you the DICOMs as well.
It's a
So
lab report, right?
yeah, but it's a DICOM format, like for those who know DICOM. No. So they can see that as well. Now, all the past appointments, as I said, are here. So for example, for this patient, if I were to actually take a consultation and clerk the notes, and I would have all the details of the patient, time, whatever the prescription is. So for this one, we have all the ICD-10 codes as well. So we would add whatever the issue was, let's say headache. So you start taking all the notes that you have. For example, in this case, I'll just write down NS, not significant. None. Now on this one, for example, if you need a prescription, you can click prescription. If you need to do a referral, you can click referral, investigations, and all of these tabs appear. And if you want to call an ambulance, you can actually call an ambulance from this service. Of course, we will not do this, but yeah, in your case, if we want, we can connect it to your 999 or 911, whatever your services are, and then call an ambulance straight from the application. Now,
straight from doctors, right?
Yes, from the doctor's application. Now, this one here, you have this prescription where you can connect it to your pharmacies. So whichever pharmacy you connect it or you have it on your on our system, we can send it to those pharmacies. And then this prescription here, we have connected it to BNF, British National Formulary. So whatever drugs are on British BNF formulary, we can add them. So for example, ibuprofen, I said 400 milligram, 14 Threesa, 52 tablets. Special note, none. Now, another thing that we can actually do is also send prescription to patient. And there is a UK and UAE specific thing, which it means that if we put a drug like,
The controlled ones?
Controlled drug. So you can't prescribe controlled drug. You have to submit it for approval.
To whom it will be submitted?
This is going to go to a senior physician who will approve it.
Okay.
So
So
you
I
can't
don't
do it.
think we have this. I mean, in we don't have this kind of system. So
Okay. So that's
uh,
fine. It's all, as I said, this is again, these are business rules which we can change. If you don't want it, we won't put it there. Like in Pakistan, there is no such thing as as controlled substances. But in UK, it's a big thing. In UAE, it's a big thing. You can't prescribe these things. Okay, and then you have a patient search option where you can actually search all the patients that are registered to your specific business rules. So for example, in our case, patient 5, so you can actually see his history directly. You can send a message from here. So for example, when I sent the message, it was like literally from here. And this is where we can so say patient can reply or patient cannot. So if it is not selected, then patient cannot reply. But if I select this, then the patient can reply to this message. So another thing you can do is you can assign and view care plans from here as well. So this comes into the chronic patient management and whatever management we want to do. So you can see patient, you can look at their different vitals, you can see the flags as well. So for example, this must have gone up. So you will have these alerts. So you can see all of the relevant things of a patient on this particular place.
So these are the data from where it's coming when from the administration.
From the
Uh,
patient.
I mean from the patient, but during the appointment with the doctor, this data has been collected, right? Or from the Apple Watch or from other
Yeah, so
data sources.
wherever we have connected it. So for example, whether it's Apple Watch or it's IOMT devices. So whatever devices are connected for the patient, this data is coming from those places. So it depends on us which places we want to connect and show the data from. At the minute, we have connected it to all places. So all Bluetooth data, all IOMT data, everything is coming in. Okay, so quickly what I will do is now, in the interest of time, I'll also go into the admin portal. Uh, so, 1186, here you go. Oh, sorry, admin. Admin. Right. So on the admin portal, you can see this is all customizable. So we can have a dashboard of whatever you want, and then in that case, we can have graphs, like say number of users, daily users, call data, what's the average call duration, etc., etc. All of the data can be set whatever and however we want this to be. And then so this is all customizable in the first go. Now another thing you can do is, for example, you can set up various admin users here. So there is a rule-based access to the whole system. So you can create hospital users, you can create admins, super admins, whatever we want to, we can create it from here. And then you can have different, all the drop downs that I was showing, you can actually create from here. So it's specialty, hospital names, insurance companies, pharmacies, devices, templates, consents, all of it can be created from this place.
After dashboard, you have explained about the search, right?
So search is any search you can, let me go there. So because of interest of time, I'm just now moving on to like very main things. So for example, you can search anything here, whether it's patient or doctor. And then on the setup, you can set up all these things that are
Okay.
sent here. Now you will see one thing here called assessment templates and consent. So this thing goes into this thing, which is the carer app or nursing app as well. So you can perform patient assessments like we do quality of life assessment. In the UK, we also do news score or you can also do GCS, Glasgow Coma Score, repetitive assessments, any other risk assessment, etc. So we would define a couple of assessments, and then you guys can put in whatever assessments you want to and add templates through this button. Also, what you can do is you can add consent templates for patient, and you can do consent as well if you want to. So this is all part of the system as well. So this is it. And then, as I said, there are lots of reports you can run, and these can be added to your satisfaction. Because what we do is we run Power BI or business intelligent analytics using these data from call data, appointment, schedule data, symptoms checked, patient count, physician billing, all of these things we can do reports. And then using those reports, we do intelligent or AI-based analytics and predict what can happen in the same season or same time frame. So, for example, in the UAE, we were during COVID-19, we were telling them that there is more load in this particular area, this particular age. So they knew that we need to be more careful on that particular age group in that particular season. So that helps us quite a lot in terms of real world evidence. And for you as a payer, it becomes easier for you to predict and prevent that thing. The whole new thing in healthcare is predict and prevent. As long as you prevent something from happening, you will avoid losing cost of care.
So you mean that all the data are like kept, for example, in a specific season, if the fever is high, then it will be recorded.
Yeah, so when we run Power BI reports, it runs by months, area, region, age group, hospital, all of those things. And then from there, we can predict what is the main factor which is actually influencing that particular thing. So, for example, if you in the UK, we predicted a couple of years ago that during June, July, and August, you will see more coughing patients and a rise in asthma cases and bronchiolitis as well because of the age group as well as the pollens. And that happened actually because we had data that proved that this is going to happen. This always happened, but we basically made a conclusion on it properly through AI. Right. So I'll quickly jump into the this patient care app thing, because this is again one of the things that you guys have mentioned as a long-term plan in terms of how would you like to provide care to your patients.
This
Now,
is the app for nurses, right?
yes, nurse and carers. So it depends on how you call it. Like in the UK, we have we call it carers and nurses. Not sure what's in with yourselves.
We have nurses. We
Okay.
don't have carers. Maybe in not in hospitals for sure.
Okay. So we have this. So let's look into it. So for example, on the dashboard, it allows you to check messages, check in report, have patients diverted into groups. So you can have multiple patients in one group according to their location, according to hospital, according to wards, and then all of their tasks assigned to this particular guy. They can see their tasks as well. So whatever their task is, they can see them and also how much they've completed and any recent issues going on, whether it's recent incidents, any medication, etc. So for example, if I go into one patient and just go into this. So first thing I have to do is check in, because when I do check in, this means that now I can see the patient and do anything with it. So I can take notes of the patient. I can log medication. So for example, I can go here. I can see uh, the medication that have been prescribed. Now, if I click view log, it allows me to log medication on the date and time it was given. So it's sort of prescription management. So you don't have to write down on paper. You can do it electronically and you can just manage it like this. Okay, so let's move on. Now, another thing that you can do with the same thing is you can add, as I said, a lot of things. You can monitor the allergies. You can do assessments. So for example, a patient comes or you need to do a GCS, you can go in and do a GCS of the patient. You can do any other assessments as well that are allowed. If you want to take a consent, you can take consent as well for medical treatment, emergency care, or whatever you want to. So for example, if I have to, I can just go in, get a consent, like this is already done, a pre-done consent. Okay, so another thing you can do is incident log. So for example, patients whether it's in hospital or care setting or nursing homes, wherever, you can actually go in and see if there are anything that has happened to patient, and you can just log it. Because then, at least in the UK, it is quite important. So what we do is we monitor a lot of these things, like falls, because fall is one of the metrics. Is an option to use if you need it. Now another thing that you can do is, where is the patient? Right. You can go in and actually log a patient as well on this incident log thing. So for example, this is a female patient, so you can see the body map. So if you want to identify something, you can actually zoom in, let's say ankle twisted. So you will say ankle twisted, ankle twisted while walking. Right. And then again, this is connected to RTM devices. So you can always have the devices connected here, as well as your health data can be monitored. So for example, urine output, fluid intake, water intake, daily weight loss or weight, oxygen, etc., etc. You can monitor a lot of stuff here. And then again, same thing, eDiary, you can have symptoms added here as well when they are in care by
So
nursing staff.
whatever functions have in the patient mobile app have the same, almost the same function in nursing mobile app, right?
It's more than that,
Yeah.
because you can have those things created here. In the patient app, you
Okay.
can't create certain things, like you can't create medication, you
Mhm.
can't create incidents, but the carer or nurse can create those things.
Okay.
You can
And then
you can create anything you want, Munawwar here. You know,
Oh,
this is the beauty about it.
mhm.
now
Okay.
another thing you will see is handover notes. So when the shift changes, you can hand over to another carer. So you can add that. And then in the task, you can see any tasks that are done, they will show as 100%. So this is like in a nutshell, like, okay, quickly, sorry, I'll also show you the dashboard for the carer. Uh, God, where is this? So you can see that they can also see it here on their dashboards. Whatever patient they have, they can see whatever was done. Even the tasks that are missed or completed, they can see what was missed, what was completed. So this helps in tracking each and everything about a patient. So that gives a lot of holistic view of patient care from all perspective, whether it's primary, secondary, or tertiary healthcare.
Mhm.
And with
Sure.
that, I think I'll stop.
Mhm.